September is National Suicide Prevention Month, and it's an opportunity to remember the lives lost, but raise awareness about suicide prevention and warning signs as well. Joining us to talk about it is Dr. Casey Green, Regional Medical Director of Connections Wellness Group. Dr. Green, thanks for being with us.
Thank you, Dia, for having me on.
Now, how prevalent is suicide?
Suicide's the 11th leading cause of death in the U.S. There's over 50,000 completed suicides a year, but really that just represents the tip of the iceberg. There's more than 1.5 million attempts a year. And you can imagine just those attempts are associated with a lot of both emotional and physical harm to those individuals as well.
What are some of the warning signs of, pending or possible suicide or even a mental health crisis?
So warning signs that you might typically see is social withdrawal in an individual who's suffering a mental health crisis, maybe some more obvious signs like crying spells, hopelessness, and just signs of emotional distress like a lot of anxiety or agitation. But you may see physical signs too, like unexplained weight loss, someone who's not attending to grooming or self-care and changes in somebody's physical appearance. Then you have the more kind of severe or real significant warning signs, like someone who's written a suicide note or saying goodbyes, giving things away that are important to them, or seeking a means or a method to complete suicide.
Dr. Green, what if somebody's listening to you and they say, man, I know somebody in my life who is experiencing some of those symptoms, or I'm starting to see some of those warning signs. What do they do?
I'm glad you asked that question. The most important thing we really can do is just ask. I think a lot of times people are afraid of asking the question because either they don't know what to do with the answer, or it's just disturbing for someone you care about to hear that they're having those kind of thoughts. But just asking the question in and of itself, are you thinking about suicide, can be therapeutic for that individual, and it can help them feel heard and their struggle validated. And so being there, being supportive in a non-judgmental, empathetic way is really the best way to help get them to open up a little bit and to get them to seek help. So if you're in that situation, sometimes just that act, and if it's the thoughts aren't too severe, just rallying some help through maybe a support or a mentor or some spiritual counselor or advisor might be beneficial. Obviously, if those the thoughts are more significant, then there are resources available using 911 or 988, the Suicide and Crisis Lifeline, which you can text or call, are good resources to seek out. You know, we do have 24-hour psychiatric emergency centers available in our community and a variety of mental health resources. We're lucky where we live in that there are options available, to individuals in our community when they do need to seek help.
Dr. Green, we just have a few more seconds, but I do want to make sure I ask you this question because I think there can be misconceptions about which populations are most affected by suicide in our community. Could you share a little bit more? Is there any age group? Is there any demographic? Is there any income group that is set apart from this?
Yeah, well, let me say one thing. So what I want to do is just say anyone can be at risk for suicide, irrespective of what age or what group that you're a part of. So all crises should be taken seriously. So individuals that are more likely to complete suicide are older males in general, and that's mostly because they have access to firearms. So one of the more significant things you can do in someone who's having a crisis is remove those firearms from the home, at least temporarily, to help reduce the means and to buy them some time to seek help. But anybody's essentially at risk. Populations like veterans, LGBTQ populations, and younger individuals may be at much higher risk for a suicide attempt, but those, again, older, isolated males are probably more likely to have an actual completed attempt. So I think the point is have the radar up for everybody and never be afraid to ask the question and to get in there and help get someone to seek help.
Dr. Casey Green with Connections, we so appreciate your time and your insight. Remember 988, that is a Suicide and Crisis Lifeline. It is available 24 hours a day, 7 days a week.